Okay, here we will perform the minor's test. So can you stand up for me? Okay, with this test, the positive will be the patient needs support moving in a seated or standing position. It indicates sciatica, lumbosacral, or sacroiliac joint lesion. Okay? Okay, here we'll be performing the belt test. Is it okay that I touch under your shirt?
Yes.
Thank you. Okay, and can you bend forward for me? Touch your toes for me. And come back up. And now we put resistance against it. Okay. So bend forward for me. Thank you. Come back up. Okay, so with the belt test, the positive would be low back pain, which would indicate one or two things. One would be pain while bending with the sacrum stabilized and unstabilized with equal lumbar involvement. Or two, pain during the sacrum non-stabilized bending and no pain during the sacrum stabilized bending equals pelvic involvement. With this test, we'll be forming Milgram's test. So what I need to do is just lift your feet. And can you hold for 30 seconds? 28, 29, 30. Okay, with Milgram's test, the positive would be the inability to perform the test and or low back pain, which would indicate weak abdominal muscles or nerve root entrapment by a disc lesion. Perform the heel walk. The positive would be the patient's inability to perform the test, which would indicate L for disc lesion. Okay, so now my patient will be performing the toe walk, so I just need you to walk on the tip of your toes to that point for me, okay?
Okay.
Okay. The positive for this test would be the inability to perform the test, though would indicate an L5 disc lesion. Here we will be performing a straight leg raise. So we'll take the patient's leg and put it up to the point of pain. Work down. The positive, it would be radiating pain and or dull posterior thigh pain, which would indicate sciatic radiculopathy or tight hamstrings. A positive between 35 and 70 degrees would mean a possible dysgenic sciatic radiculopathy, and a positive test less than 70 degrees would equal tight hamstrings. The Linder sign. So what I'll do is I'll bring your head to your chest. Okay, put your head down. So the positive with that, it would be pain in the posterior thigh or leg, which would indicate sciatic radiculopathy. We'll be performing Braggart sign. Okay, here the positive will be pain in the posterior thigh, which would indicate sciatic radiculopathy. Here we will perform Sikar sign. So, here. Okay, here a positive would be posterior thigh and leg pain, which indicates sciatic radiculopathy. Here we will be participating in the Torrent sign. So, do is dorsiflex your big toe. Okay, so the positive for that would be pain in the posterior thigh. It would indicate sciatic radiculopathy. Here we will be a little inventive with the bonnet sign because we don't have a table. So what I'll be doing is lifting my patient's leg, internally rotating the foot, and abduct the leg across the midline. So here, it would be a positive. It would be pain in the posterior thigh or leg, which indicate an immediate pain in sciatic neuropathy from the pisiformis syndrome. Okay, here we'll be doing a well leg raising test. So we will say that the affected leg is on here, the right side. So that means we'll be raising the left leg in a straight leg raise. Okay, there are two positives and two indicators for this. One positive would be pain down the affected leg, which would indicate a medial disc protrusion, or a decrease in pain down the affected leg, which would indicate a lateral disc protrusion. Here we'll be doing the Tanel foot sign. Here's my reflex hammer. This is how it feels. You feel that?
Yes.
Okay. Okay. So the positive for this would be paresthesia radiating into the bottom of the foot, which would indicate tarsal tunnel syndrome. And now we'll be doing. And here we will be performing Morton's test. So just need your foot. Okay, the positive for that would be a sharp pain in the forefoot, and it would indicate metatarsalgia or neuroma, usually in the third and fourth metatarsal interspace. Here we will be improvising again for the femoral stretch test, aka the femoral nerve traction test. So what I need for you to do is tuck your head into your chest for me. Okay? And what I'll do is that I'll flex the leg and stretch all the way back. There we go. The positive would be pain on the anterior portion of the leg, which would indicate traction of the femoral nerve, indicating involvement of the second, third, and fourth lumbar nerve roots. So now we'll be performing the Kim test. So I need you to cross your arms for me. Okay, so I'm going to bend you this way. Bring you back. And the positive for this event would be, is one of two. The first one would be pain, usually radicular, recreating existing sciatic pain, which would indicate disc protrusion. In the medial disc protrusion, Kim's will be positive as the patient is leaning away from the side of pain. In the lateral disc protrusion, Kim's will be positive if the patient is leaning into the side of pain. 2, the pain would be local, which would indicate localized pain. Localized pain may indicate lumbar spasms or facet capsulitis.